Welcome to Adapting Class. Of course, fundamentals is very important in the NCLEX, and sometimes IV fluid is part of the renal system, and at the same time part of fundamentals. This is a crash course giving you the content you need to know for IV fluid and what is the indication, when do you use it, and what do you need to know, some of the key facts, right? Before you can know that, you just have to know fluid distribution in our body. Very important. That's the first thing. Anybody, average individual has about 50 to 60% of water in their system, depending on whether you're a male or female, but average 50 to 60%. This is divided into extracellular fluid and then intracellular fluid. So it's very, very important that you know the difference between them, the intracellular and extracellular fluid. So I'll put the intracellular fluid here. That is inside the cell. In the inside the cell, that constitutes about 30 to third of the water, the 50-60% I told you. So most of your water are inside your cell. And then only 1/3 is outside the cell. Unfortunately, the 1/3 is also split in the extracellular fluid. It is split between two segments. We have the plasma and then the interstitial fluid. The plasma, of course, is a very big area, but it constitutes about 20%, which is part of your blood, right? Where the blood cells float in it. And then the interstitial, so this is interstitial fluid, constitute about 80% of the 1% of the extracellular fluid. In between the extracellular fluid and intracellular fluid, you have, this is the cell membrane. The cell membrane preventing communication between the extracellular and intracellular fluid. The only thing that move easily is water. So water move easily back and forth. So these can exchange water between each other. Water can exchange between the extracellular fluid and the intracellular fluid, right? But if electrolytes need to move around, they have to use pump. As you can, you know of, you have sodium, you have potassium, you have magnesium. These are the electrolytes. You have chloride, you have bicarb. Their concentrations are different inside the cell and outside the cell. And so they cannot move freely. They need a pump to move them back and forth. So we have to use energy to move it. The only thing that move is just water across the cell. And as you know, the potassium is more inside the cell. So this potassium concentration is very high intracellularly compared to extracellular fluid. So it changes. Of course, we have proteins to involve and we have albumin. Albumin is example. These are big tissues that cannot move across the cell. So this is the basics information. Water move by osmosis. The rest of the electrolyte and the protein, they have to move through channels because of charges, and they have to move through with a lot of energy before they can go through the cell. So this is the basis of it. This is the first portion you have to know before you can understand fluid electrolyte. After that, there is different kind of fluid. We have crystalloid and colloid. The crystalloid are divided into different segments. Mostly, they are just water electrolytes. They're made up of water and some electrolyte. The colloid, they are like blood, albumin, and other molecule that I'll describe it later on, something we call expand and destran. They are like expanders. They are extracellular expanding, make the extracellular fluid bigger, and then it can use it in certain situation. The key fact is the crystalloid that your board may ask you, right? The different kind of crystalloid, right? Then they distinguish between the plasma. We name them based on your plasma. If you have the same concentration as plasma to this crash course, it's going to be called isotonic. Okay. If your concentration is greater than the plasma, you'll be considered hypertonic. If your concentration is less than of that plasma, you'll be considered hypotonic. That's all. And then you have to know what kind of fluid are involved as hypotonic, what is fluid is isotonic. So let's take isotonic fluid into consideration. Isotonic fluid concentration, they have the same concentration as that of a plasma. How would you know which one is isotonic? First of all, you have to know what is the use of it. Because it's the same concentration as plasma, when we give it to you, it stays in the plasma. It stays in the plasma. So we use it specifically if you dehydrated. That's the dehydration is very common. Um, if you have shock, we can use this fluid for that. If you burn injury, the specific fluid that we can use for that. If you have surgery or trauma, because we want to replace the extracellular fluid concentration. So these are the fluid that we use. Isotonic, same concentration as the plasma. Think about plasma as having 1% concentration. A good example is sodium chloride, right? This is one. This is a 0.9% sodium chloride. This is an isotonic fluid and is an unbalance because of the concentration involved. So this is isotonic because it almost has the same concentration as plasma. Lactate ringer is also isotonic. Remember, this is specifically used for like burn. If you have burn because of the acidosis that will cause use of sodium chloride. If I give you too much sodium chloride, you develop acidosis, hyperchloremic metabolic acidosis. So we don't like giving you too much sodium chloride when you have burn injury. So that's why we choose lactate ringer. It's very, very good for burn specifically. And even surgery, if you're going to have surgery, this is what we use. Trauma patient, we like to give them lactate ringer to prevent massive amount of sodium chloride that will cause acidosis. So these are very, very good fluid. This you have to know D5W. So D5. This in a bottle, that means sitting down in the bottle, is isotonic. But when you infuse it, it get metabolized and it become hypotonic. So watch for that question. Um, that D5W in the bottle without infusion sitting there is an isotonic fluid. But when you give it to somebody, it get metabolized and it become hypotonic. So these are the common isotonic fluid usually they may ask you. If your concentration is less than that of plasma, you are hypotonic. And so you cannot be 1%, right? So instead of 0.9%, you get 0.45% normal saline. This is the most common one. And then D5W, like I said, infused is not in a bottle. D5W infused is an hypotonic solution. But if you put it's in the bottle, it's an isotonic solution. That's the key. When do you use this situation? Remember, if the concentration is lower than the plasma, it will make fluid shift. So fluid will shift into the intracellular cell. So these fluid will make cells swell. So because the concentration is less than the plasma, if you put it in a plasma, it will shift into the cell and make the cell swell. That is why this is bad for ICP. If somebody have ICP issue, you should never give this to them because the cells will swell and it burst open. So never use this hypotonic fluid in ICP issue or brain injury. It will make it swell. Okay. The next one is hypertonic fluid. So they are hypertonic. That means what? Their concentration is higher than that of plasma, right? Greater than plasma. So what they're going to do, they're going to pull fluid from the cell. So it make the cell dehydrated. Basically, it pull fluid from the cell. So this is very good for ICP. When your brain is swelling, we use this to pull fluid out of your brain. So it can pull fluid into the extracellular fluid. Example is mostly 3% normal saline, because if um, plasma is 1% and you have to be hypertonic, you should be greater than 1%. So 3% normal saline, 5% normal saline, right? These are classic hypertonic and fluid. There are few hypertonic fluids that sometimes you may see, um, but if you metabolize them, they change. So watch for that. They may try to trap you. Okay, especially D10. D10, dextrose 10% in water is not D5, D10. This is actually hypertonic solution. But when you metabolize it, it becomes hypotonic. So this in the bottle is hypertonic, and we use this in like in TPN. If you need, you're on TPN, and then they stop the infusion. So these are three solutions. You have to know when to use them. What are the indication? Of course, if your sodium is too high, we will give you hypotonic. If your sodium is too low, we give you hypertonic. So these can be used hyponatremia, treatment of hyponatremia to prevent seizures. Because your sodium is too low, we can give you hypertonic solution. You see, these are crash course to lead you to figure out what is going on. There is some few information I wanted to know about these dextrose solutions. They're very confusing, and I'll make it easy for you. Look, they are water in sugar, right? So sugar water, D5W, is basically 50 grams of glucose in the liter. And this can also give you calorie, get metabolized into 170 kilocalorie per liter. And then the D10W is about 100 gram per liter. When you metabolize, it's twice of that, 240 calorie per liter. The problem is when they sitting in the bottle is different. And once again, D5W is an isotonic in the bottle. Okay, when I give it to you, I infuse it, it get metabolized, it become hypotonic. So this become hypotonic solution. D10, as I told you, is hypertonic. It's an hypertonic solution. Very, very important, right? But if you get metabolized, it become hypotonic. So these are little things you have to know. So if I tell you D5, okay, D5W, if you had, okay, half normal saline, remember, half normal, so 0.45 normal saline. Remember, D5W is hypertonic, right? Is isotonic, and 0.45 is hypotonic. So when you add isotonic and hypotonic together, this become hyper. This is an hypertonic solution. It's now higher than D5 or higher than plasma concentration. So it's now hypertonic. But when you metabolize it, it will turn into hypotonic because you metabolize the D5. Now you left with 0.45%. This become hypotonic. It's different if it's D5W, okay, plus D5, okay, normal saline, right? D5 normal saline. This is hypertonic, but when you metabolize all the D5, you end up having isotonic solution, right? The same thing, D5W plus LR, this is hypertonic solution, but when you metabolize it, it becomes isotonic. So watch for these information they will give you. Once again, these are all hypertonic solution. This is hypertonic solution. Okay, when you give it to somebody, it's hypertonic solution. This is isotonic. This is also hypertonic, and it will break down into hypotonic solution. So this is just brief information. And then if they give you the colloid, the colloid are just extracellular expanders. This example is albumin. We have like 5% and 25%. They used to expand the extracellular, so they stay in the extracellular fluid. They don't go into your blood, to the cell. And they used to pull fluid from the interstitial fluid. Like if you have edema, or it can pull fluid and let it stay in the extracellular fluid. So it's very, very important. Improve in oncotic pressure. Another fluid that it can use is Espan or Destran. The problem with these two is because of this. They're very expensive. They causes more allergic reaction. They causes more immune response. These are the difference between a colloid and crystalloid. Expensive, allergic, immune response. So watch for that. It can affect your platelet. It can affect your clotting factors. So sometimes they ask you questions related to that. These are key things you have to know. In brief, know the name of the fluid, know which situation you're supposed to use it, which condition you need to use it, and what is the implication of that. And which fluid are hypotonic, hypertonic, which solution are hypertonic, which situation is good for, and what happened to those D5W when they are inside the cell versus they are in the bottle. Take care of yourself. Crash course, fluid. Take care. Bye.